right, so which of the following patients presenting to the emergency department with suicidal ideation would be considered highest risk for completed suicide if released from the department? So this is a challenging question, and before we go over the answer choices, let's dissect exactly what we're being asked. Okay, so we have four scenarios of patients presenting to an emergency department, and they all have suicidal ideation. And of these patients, we need to know who are at highest risk for completed suicide. So this is in the acute setting, and that's important. Let's go through the answer choices and then try and answer the question. So answer choice A, a 25-year-old African-American man who reports depression in the setting of a recent breakup with his girlfriend. B, a 35-year-old white woman with a history of schizophrenia who has not been compliant with her medications. C, a 50-year-old white man who works as a physician and has been diagnosed with severe depressive disorder. And D, a 60-year-old married African-American woman with cancer who is tired of her chemotherapy and is ready for it to all end. So we have these four scenarios. And what's important to know is that if we're in the clinical world, each one of these patients are at risk for completed suicide. And if they come in with suicidal ideation, and they need to be worked up appropriately and provided the appropriate support. All right. Now, the question, however, in order to answer this correctly for exam purposes, we need to identify which of these scenarios has the most risk factors. So we know that the risk factors are correlations with suicide. They're not necessarily causations. So we just need to identify which scenario has the most risk factors. So let's start with answer choice A. A 25-year-old African-American man who reports depression in the setting of a recent breakup with his girlfriend. So this is a younger gentleman, 25 years old. So that is not a risk factor. He reports some depression. That's a risk factor. And breakup with his girlfriend, that's typically a temporary type of event. Nonetheless, there is risk here, but we don't have multiple risk factors here. So we will just keep that in the running and then come back to it. Then we have answer choice B. So we have a 35-year-old who's still not really old enough, right? Older age, those above 45 are at increased risk for suicide. Her being a white woman is also a risk factor, but she has schizophrenia and has not been compliant with her medications. Those are not risk factors for suicide. So again, we have one risk factor, so not anything that jumps out. And choice C. So here we have an older gentleman, so 50 years old. The age here is a risk factor. We have a white man. This is also a risk factor, right? There's greater correlation with that. Certain occupations are associated with increased risk of suicide. So as a physician, there is increased risk of suicide there. And he has severe depressive disorder. So this is another risk factor. So multiple risk factors here. Certainly, this is a high likelihood that this is going to be the answer, but let's see what answer choice D is. So we have a 60-year-old, which is a risk factor, but we have a married woman here. So marriage actually reduces the chances of suicide. African-American woman and who has cancer and is tired on chemotherapy and wants to end it all. So not necessarily a risk factor. Clearly in the clinical sense, she should be connected with palliative care specialist or team. But as far as completing suicide, for this question, this is a low likelihood. So if we look at all of our answer choices, let's cross out A. We only have really one risk factor of depression. Answer choice B, we have one risk factor. Answer choice D, we have one risk factor, but the patient's married. So that kind of cancels that out for the sake of this question. And in answer choice C, we have multiple risk factors. So this is the answer that I'm going to choose. And sure enough, we are correct. So to answer this question, it's important to know risk factors for suicide and then kind of calculating which of those scenarios have the most. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.